Welcome to get all the cardiovascular exercise that you need plus more in just 3 minutes a week. I'm Dale Walker and I'm the founder of FixYouOnline.com. As a corrective physical therapist with additional degrees in fitness and exercise science, I teach and create programs that empower people to take control of their health and healing. You can reach out to me, support at dlwalkerconsultant.com, as well as on LinkedIn and Facebook. And as always, check out my programs at www.fixyouonline.com. So what is HIIT? Today I'm going to talk about it. And it's most commonly known as high intensity interval training. It's also known as high intensity interval exercise and SIT, sprint interval training. There are various different protocols associated with HIIT, and I'll share some with you later in the presentation, as well as the one that I do, and some safe modifications of the protocols for people who have particular concerns. How did HIIT develop? According to Wikipedia, it was in the 1970s. There was a middle distance runner. His name was Sebastian Coe. And he was a British runner and won world records in the 800 and 1500 meters, as well as Olympic gold medals in the 1980 and 1984 Olympics. His dad was his coach, and he had him doing intervals of 200 meters of sprint, followed by 30 seconds rest, and then 200 meters again, followed by rest, over and over again. So for him, that training clearly worked. He held world records for a number of years in both the 800 and 1500 meters. And then some folks kind of started training athletes back in the 90s. HIIT training is very appropriate for certain sports like volleyball, tennis, soccer, basketball, football, and anything that requires bursts of energy followed by a period of rest. Many types of sports are extremely appropriate for this kind of training. So their coaches, knowing the principle of specificity of training, went ahead and started training their athletes this way. HIIT became more popular around 2008. I knew about it back then, and in 2019, HIIT was voted the most popular fitness trend. Today, there's a good amount of research supporting this type of training with a variety of individuals, and personally, I'm really excited about the research that I've been finding. I'm going to be sharing with you some of the research and let you know that the studies that have different protocols. And what does that mean? It means that the different protocols called for different amounts of intensity and duration of time where people were working at a high level and then resting. So some people went out at 100% during their high intensity, and some people did 90%. Some people did 80 to 95%. And during their rest period, they did nothing. So it's important to take a look at these particular studies to find out exactly what was done, and this is just a synopsis. Here's some of the research. And this one I was really surprised about learning. This is on individuals with a diagnosis of Parkinson's disease. And who would have thought that they found that interval training decrease the symptoms of rigidity, stiffness, and frequency of both in patients with a diagnosis of Parkinson's disease. Rigidity and stiffness are common symptoms of Parkinson's and interfere with mobility, activities of daily living, and can contribute to falling. Hypertonia, which is known as an increase in tone, is a common symptom of Parkinsonism, and it's an increase in muscle tone, but not in a good way. It means that the neurological system is not turning off. This also impacts activities of daily living. Here's a positive about the interval training was that there was an increased level of brain-derived neurotrophic factor relative to pre-training values. So it's highly encouraging for individuals with Parkinson's disease. As a matter of fact, Parkinson's patients benefit greatly from boxing, and boxing has that intense movement followed by kind of a hopping around the ring or a little bit of rest. So jab, 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 rest, 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 high intensity followed by medium intensity workouts. And boxing has been shown to benefit people with Parkinson's disease. This next study looked at the adaptation of people of varying ages. And what happens with metabolism is that when we get older, there's a decline in the muscle's mitochondria. And what they found in HIT, that mitochondria, as we know, is the powerhouse of the cell. And it helps to generate ATP, or energy. It's kind of like gasoline, right? It's really what fuels our cellular metabolism. What researchers found was that positive training adaptations occurred because there was increased gene transcripts and ribosomal proteins, as well as a reverse of the age-related decline in the cell's mitochondria. So when things that were supposed to decline with age, with interval training, they found that there was an increase or an improvement. The next research was really shocking to me. I have an undergraduate degree in fitness and cardiac rehab, and when I graduated college, if I heard that you were doing high-intensity training on a cardiac patient, I would have thought this risky and dangerous. We were taught that maximum benefit was at an intensity of 60 to 80% of your maximum heart rate for 20 minutes of steady state exercise 3 times a week. But what these researchers found was that it was just as beneficial, if not better, for the cardiac patients with regard to rehab. So these were people who had bypass surgery. These are people who have had heart attacks. These are people post-angioplasty. They're considered phase 2 cardiac rehab. And they had beneficial effects, if not better effects, with high-intensity interval training when they compared it with the steady-state traditional cardiac rehab exercise. Here's what they found. They found it to be safe. They found it to be better tolerated because there were rest periods that were involved, or lower intensity periods. There were many positive short and long-term changes to the central, meaning the heart, benefits, as well as peripheral, meaning outside the heart, benefits like muscles. There were better clinical improvements than traditional exercise. What they call MICE is moderate intensity continuous exercise. That's what I was taught. There was improved oxygen uptake, ventricular function in the heart, that's what pumps the heart, endothelial function, which is the functioning of the lining of the heart and blood vessels. All were found to benefit from high-intensity interval training. Improved quality of life, and then also, very interesting, better compliance to exercise. When you think about it, traditional, what they call MICE, moderate intensity continuous exercise, is kind of boring. But with HIT, you're constantly kind of recovering and then going at a higher intensity, recovering and going at a higher intensity. And in this particular study, it was 15 seconds of high intensity at peak power with passive recovery of the same duration. So 15 seconds on, 15 seconds off, and they found that to be most effective in preventing cardiovascular disease. HIT appears to be a safe and effective alternative for rehab with patients with coronary artery disease as well as heart failure. So even with signs of disease, as long as they have been cleared by their doctor, what's interesting about the patients with heart failure is that adaptations occur outside the heart. So if you have heart failure, you actually have damage to the heart. And therefore, the heart can only do so much. So in order to accomplish the things that we need to do in our daily life, we need our peripheral body outside the heart to be working optimally. And that's what HIT has been able to accomplish. So even cognition, in this particular research training, in as little as 6 weeks, according to the Journal of Cognitive Neuroscience, high-intensity training done for 20 minutes at a time improved participants' memory, particularly the kinds of memory that helps you to determine two similar memories apart. I became really interested in the whole HIT training when I watched this documentary on the BBC. It was done by researcher Michael Mosley, who found that just 3 minutes of high-intensity exercise bouts in a week would offset or show improvements in insulin sensitivity and some risk factors to type 2 diabetes, obesity, and heart disease. And what they found was that insulin sensitivity increased by 24%. And what they also found was that 15% of the individuals who did this kind of exercise responded really, really favorably. Then 65% of the individuals in the study were what they called medium responders. So they responded well. And then 20% of the people were what they called non-responders. They did not show the benefits in insulin sensitivity. And there could therefore be kind of a genetic predisposition to adaptations to high intensity interval training that might need to be considered by an individual who undergoes it. So what are the benefits that we found? Well, we found that it adds energy, improves circulation, it's good for cardiovascular health, excellent for type 2 diabetes, maybe something to help control type 1 diabetes, benefits to brain health, helps to decrease stress as long as you don't do it more than 20 minutes. So who would have ever thought that a professional would be telling you to exercise less, right? Don't exercise more than 20 minutes. When you do this, it may cause a cortisol reaction or an increase in stress. It increased volume of oxygen consumption from the blood to the cells. There was an increase in enjoyment and mood, decreased abdominal fat in a study done on obese patients, improved blood pressure, and as I mentioned before, too much is not good. Is it safe and what are the risks? I have not found in any of the research that I looked at that demonstrates that HIIT training is any more risky than any other form of exercise. So how do you go ahead and safely try HIIT training? First and foremost, you need to discuss it with your doctor and make sure that it is okay for you to exercise between about 90 and 95% of your maximum heart rate. Second, you need to choose a safe environment where you're not at risk for falling or orthopedic injuries. So such a great place is the kitchen, because the kitchen, you have counters that are very sturdy and stable to grab onto, as well as a bathroom that is an enclosed area with not a lot of room. So if you lose balance, you'll knock into a wall. And again, you can have the sink to grab onto should you feel woozy. The third factor is really begin slow. And when I say slow, what that means is only do about 4 bouts of high intensity followed by medium or passive work for 20 seconds on and 40 seconds off. That's just a general recommendation. Like the Canadian study, they did 15 seconds on, 15 seconds off. You need to figure out what is tolerable for you at this moment in time, and then you can start moving it from there. What I would suggest is that if you feel up to it, increase or add 1 bout of exercise every 2 to 3 days. So if you start with 4 minutes, if you can do that for 3 days without too much trouble, then go to 5 bouts. And in 2 to 3 days, if that's okay, go to 6 bouts and continue to increase at that kind of level. But again, do not exceed 20 minutes. The fifth factor to consider is that you don't need to do more than 9 20-second high-intensity bouts per week. That's it, as far as seeing some benefits in certain areas of your body, including the insulin sensitivity. If you have any orthopedic or balance concerns, you can begin in sitting, and I'm going to demonstrate that in just a few minutes. So here are some modifications to HIIT training, ways that you can do it. You don't need to be at a gym. You don't need to be outdoors. You can easily do this in your home, and that's where I typically do my HIIT training. I will sometimes do it outside, but 90% of my HIIT training is done in my kitchen. And how I do it is a bit unique. because I get my dishes done and my kitchen cleaned up all while I'm doing my HIIT training. And I am going to go ahead and show you two videos that I filmed separately. First, how I do my HIIT training, and then how to modify HIIT training to a seated position for those of you who may be unstable in weight bearing or have orthopedic concerns. If you have an exercise bicycle at the house or a treadmill, you can certainly do any kind of HIIT training on a piece of cardiovascular equipment. Again, just make sure that you are comfortable and safe doing it at a level that elicits about a 90% of intensity. So what that means, on a scale of 1 to 10, if 10 is the hardest you can go, you're just below that level. That is what's considered high intensity. The only other thing you'll need is your stopwatch. So enjoy how I HIIT and also the HIIT and sit training. Hey everyone, it's DL, and here I am in my messy kitchen. I made some chili last night and I'm a very sloppy cook. So I did this on purpose so that I could show you how I do my HIIT training while cleaning up my kitchen. So what I do is I take my iPhone back there and I set the timer to stopwatch. So I go on, I get into my clock, and I go ahead and go into stopwatch. And then I just go ahead and press the start button, and I move for 40 seconds. So my dishwasher needs to be emptied, so I'll go ahead and just get my dishwasher emptied, keeping an eye on the clock. And when the clock hits 40, I go ahead and I'll do my interval sprint at that point for 20 seconds. So I go ahead and wait for it to come up to 40. I'm at 27 right now, and 30. So I'll close this up. I'll close the dishwasher, and I can just arrange a little bit more because I like to be organized. And there's 40. So I'll do jumping jacks, and I'll go as fast as I can for 20 seconds. And I keep my eye on the clock, and note the time. I have 10 more seconds to go. And 5, 3, 2, 1, and stop. And then I go back to emptying my dishwasher. Similarly, I can go over to my sink and load my dishwasher, wipe down the counters, brush my teeth. You can really incorporate this into anything. Folding the laundry. You fold for 40 seconds, you HIIT for 20. I don't have a lot of time in my life. I'm a busy person. And as much as I really do enjoy exercising, being able to do this and get the work done that I need to do in the house, for me, makes the housework a lot more tolerable. I like doing the HIIT training in a kitchen because if you lose balance, you have counters nearby to support you, or you can even support yourself while you're doing the HIIT training. So go ahead and see what you think. Let me know after the presentation if you go ahead and decide to incorporate this, and certainly share with me your personal experience. Here is sit and HIIT. So what we're going to do is we're going to move our feet in a circle with our full foot on contact with the floor. We're going to do this for 40 seconds, and then after 40 seconds, we're going to go as fast as we can forward and back, like cross-country skiing, as fast as you can for 20, and then we'll go back to 40. Now with 40 seconds, you can actually swing your arms as well if you like while you're doing the circle, or just sit stationary. Last piece of information is that if you have foot concerns, then wear socks when you're doing this, or if it's difficult for you to do this barefoot, then put some socks on when you're doing this. You get ready to start. So we're circling. Again, we're keeping our foot in contact with the floor as we do this.
We can add arm movement, and we're just going at a comfortable pace that we feel that we can maintain a conversation as we're doing this activity. Again, it's important to keep your feet in contact with the floor as you're moving around in the circles so that you're getting great range of motion in the hips, the knees, and the foot. If this is painful, you can certainly move just straight forward and back. Get ready to go as fast as you can in the forward and back manner. Ready, and go. So you're going to move your arms vigorously. You're going to move your feet as fast as you can. Keep going. You should not be able to maintain conversation as you're doing this. And keep going. We'll get ready to switch. And switch. So now we'll bring it back to normal pace. This is great for your hamstrings, by the way. And if it's too much on your hamstrings, go ahead and put a pillow under your bottom as you're doing this activity so that the height of your hips is higher than your knees. So we're just moving forward and back. Or again, you can do circles. 40 seconds that we're doing this. And then when we go as fast as we can for 20, we're going to move our arms and legs vigorously in 5. And get ready to go. And go as fast as you can. Keep going, keep going, keep going, keep going, keep going. Move those arms. Move those legs. Keep going. Keep going. You should feel yourself winded at this point in time. Keep going about 90% of your maximum. So on a scale of 1 to 10, about a 9. And last set. So take it nice and slow. 40 seconds. Catch your breath. Get settled. Again, if this is too much on your hip or your knees, either elevate your bottom or just go forward and back. If this is too hard on your hamstrings, go ahead and, again, raise your bottom when you're doing this. Keep going. Get a good recovery here. And we'll get ready to start in 5. Get ready to go. Last set. Really push it. Last one that we're doing. Keep going. Move those arms. Move those legs as fast as you can. Keep going. Keep going. Keep going. Almost there. This is the last one. And let's take a nice 40-second break just to cool down. And you can move arms or legs however you like, but just take it nice and slow so you can get your breath back. And then pat yourself on the back because you got all of your cardiovascular needs done for one day, and you just need to do this same activity 2 more times a week, according to research, to help with insulin sensitivity, as well as weight maintenance, as well as cognition. I haven't found a thing that this is not good for. And we are finished. Good job. Woohoo!
So I hope you enjoyed this presentation. Again, I'm D.L. Walker. Please do reach out with me with any questions, concerns, and go ahead and if you're interested in learning how to incorporate correct exercise, meaning exercise that's actually going to do your body the most good based upon your needs, please do sign up for my 7-day free trial of Correcticize. What I'm going to do in those early trainings is we're going to give you some daily information about how to incorporate the Correcticize program and tailor make it for your specific needs. So in this training or in this program, we have something called that's extremely unique called the Total Body Repair. And what it does is it teaches you to release, realign, rebalance, and re-educate your body to undo the wear and tear of time. So go ahead and check it on out, www.fixyouonline.com. Thank you so much for watching, and I'll see you, hopefully, in a next training. Ciao.